Let's tell the listener like what sleep apnea is, what happens to you during the night, what it affects.
People always wonder, why am I tired? Why am I not being able to be very productive? While there are several reasons for that, sleep apnea is accounting for a big percentage of that chunk.
Do you ever see cases where if the patient dramatically loses weight that they can come off the CPAP?
In the past, we used to refer patients to nutritionists, talk to their primary care doctor about option, changing their lifestyle, trying to make them more interested in physical activities.
Hey guys, welcome to the show. Today, I want to talk to you about something that you should be spending a third of your life doing. Most of us are not, and it could be holding us back from leading our most happiest, healthiest, productive lives. And our subject today is sleep. And sleep may not be the first thing that you think about when you're thinking about improving your life. Maybe you're thinking about your diet, your exercise, or spending more time with your family and friends. And those things matter. But quality sleep can affect every one of them. For decades, physicians and scientists have known that the quality of your sleep can affect your productivity and your living longer, thinking clearly, improving your mood, reducing your risk of chronic illnesses, and just feeling better. And I know we've all been there where we've had periods of time where we're not sleeping well, and you know how quickly things unravel. Your mood sours, your focus is off, your energy stinks, and even the healthiest of habits, the healthiest of your habits, becomes difficult to do. So today I have with me a physician who has spent over 3 decades of his life helping people to sleep better, breathe easier, and recover from some of the most serious illnesses imaginable. Dr. Lebnan Saad has spent over 30 years treating patients. He's also spent his time doing research in his various fields of study, and he's been director of various hospital units and pulmonary physician offices. He's board certified in critical care medicine, sleep medicine, and pulmonary medicine. And so while he's been dealing with the seriousness of critically ill patients in the intensive care unit, he's also helped thousands of patients to sleep better who have such common diagnoses as obstructive sleep apnea. So today we are going to separate sleep myths from scientific facts. And in so doing, we are going to also look at your medication list. Is there anything on there that could be keeping you from having a good night's sleep? What about your partner snoring? Is it simply a nuisance or is it something that you should go get checked out? And we'll talk about our daily habits like tobacco, alcohol, caffeine, how those can dramatically affect your health as well. So, whether you're a person who is having trouble falling asleep, or you are waking up exhausted, or you want to increase your longevity, I think we have a great episode for you today, packed full of practical tips, science-based evidence that can help you to start feeling better and sleeping better tonight. Guys, please help me welcome my guest, Dr. Saad, to the show. Hey, Dr. Saad, welcome.
Hey, Shelley, how are you? Good to see you.
It's good to see you too. All right, so I think we talked a little bit earlier about, obviously we want to get into sleep. That's a huge thing. Everybody wants to sleep better, right? But let's start that conversation with obstructive sleep apnea because we know it is so common in this country and it definitely is affecting people's sleep. So take it away. Tell us about it.
It's definitely one of the most common disorders when it comes to sleep, and the one that is mostly underdiagnosed. The 95% of the cases we see in sleep clinic are basically sleep apnea. Even though sleep medicine cover a lot of wider variety of sleep disorders, sleep apnea is by far the most common. And it affects, based on the most recent statistics, it affects 39% of the adult male population in the United States, 25% of adult women. So that's more than 80 million people with sleep apnea that have this condition, and the biggest majority of them are not even diagnosed. So people always wonder, why am I tired? Why am I not being able to be very productive? And while there are several reasons for that, sleep apnea is accounting for a big percentage of that chunk.
So what I hear you basically, you just said like 4 in 10 males in this country may have it that we have diagnosed so far. And then that's 1 in 4 females. So it's like really
Exactly.
common. What are the reasons it's so common?
So it's even becoming more and more prevalent over the years because it's strongly associated with the body mass index and the degree of obesity. And we
Hmm.
are becoming more and more obese over the years. The lack of physical activity, the lifestyle. So with the average increase in the body mass index and our size, the sleep apnea is becoming more and more common.
Yeah. And I definitely want to talk about the weight loss issues a little more in a second. But if you can let's tell the listener like what sleep apnea is, what happens to you during the night, what it affects you, in
Sure.
terms of your body and your daytime routine.
So it is an anatomical problem in the upper airway. For us to continue breathe, the airway has to be patent throughout the whole time, and that's never a problem during the daytime because there are muscles around the airway that are extensor muscles that their job is to stretch the airway wide open and keep the patency of the airway. The problem when we go to sleep, those muscles relax, and even a normal person without sleep apnea, the diameter of the airway is a little bit narrower when you go
Hmm.
to sleep, and the resilience of the airway to collapse becomes more compromised at night. So people with sleep apnea have a little bit more extreme impact on that, where the airway can either become so narrow that we're not getting enough air, or they can completely collapse and there's complete cessation of breathing.
Hmm.
And luckily, the brain is always watching. So when we're sleeping, the brain is monitoring the heart rate, your oxygen, and if there's any interruption or any problem with that, there's always the brain attempt trying to fix it. So when you go to sleep and you quit breathing, the brain is watching, and after a few seconds of no airflow, the brain is going to trigger a mechanism trying to fix it, and that's typically when we wake up.
Okay.
The second the person wake up from sleep apnea, the airways muscles are automatically activated when we're awake. So it stretches the airway wide open and we resume breathing again, and it goes in cycles.
Hmm.
And this can be a mild case of sleep apnea where the patient might quit breathing 5, 6, 7, 8 times per hour. Or we've seen cases of severe sleep apnea where the breathing interruption is up to 100, 120 times per hour. So basically, they
Incredible.
spend more time trying to breathe against a closed airway than breathing at night.
Right.
So when that happens, when the patients wake up at night from an episode of sleep apnea, some of them can remember waking up 5, 6, 7, 8, 10 times per
Okay.
night. That's really the tip of the iceberg.
Wow.
The patient with sleep apnea can wake up every time there's a breathing cessation, and they don't reach the level of awakening that they can remember it. So they wake up for 5, 10 seconds and they drift back to sleep. It's a microarousal, not enough for them to remember it, but enough to affect the sleep quality. So after having 50, 100, 150 awakenings or microarousals per night, the patient wake up tired, groggy, they cannot concentrate, and they find themselves sleepy trying to do tasks that are boring or non-engaging.
Hmm.
That includes working,
Hmm.
especially if you work on a monitor in front of a monitor, or what's more dangerous is driving as well.
Yeah, absolutely. And so I imagine if you're getting your airways getting cut off while you're sleeping, it's having all kinds of bad effects on your body. Can you tell us about
That's
that?
that's where the risk of cardiovascular disease come in. So the cardiovascular system is active 24/7. Your heart cannot take a break. But at night when you're sleeping, typically the heart rate should slow down and the blood pressure slows down and drops a little bit. So that's when the heart is getting its break or time off.
Yeah.
And patients with sleep apnea, the opposite is happening. The workload on the cardiovascular system, sometimes even more at night than when physically active during the daytime, because when there's breathing interruption, the body is stressed out, the heart rate goes up, the blood pressure go up, the patients wake up from sleep, the stress is gone, it goes back down, and it happens over and over and over again. This fluctuation will destabilize the heart rhythm, increase your risk or the risk of atrial fibrillation,
Hmm.
arrhythmias, and also the cardiovascular system becomes so overworked that the risk
Yeah.
of hardening of the blood vessels, congestive heart failure, hypertension, even stroke is much higher in untreated sleep apnea.
Okay. So definitely heart disease, stroke, and tell us about some of the treatments for sleep apnea.
So the treatment is there are more than one option to treat.
Mm-hmm.
From the sleep medicine standpoint, most of the sleep physicians are biased to CPAP because we like it. It's by far the most effective treatment out there. Maybe not the most convenient one,
Mm-hmm.
but it does work better than any of the other option out there.
Mm-hmm.
So when it comes to sleep apnea, since it's a spectrum, sometimes the treatment we offer depend on the severity of the condition.
Okay.
So mild cases of sleep apnea, maybe the impact on the cardiovascular system is only marginal. So we tend to treat those who have issue with fatigue, problem with concentration, and when it becomes moderate or severe. In other words, if the person quit breathing more than 15 times per hour on the average, then the risk on the cardiovascular system becomes high enough that treatment becomes very important because it will serve as preventive medicine, trying to reduce the risk for cardiovascular disease. Put aside the impact on their sleep quality, we're talking risk for strokes or heart attacks or congestive heart failure, etc.
Right.
So the CPAP becomes the number one treatment for those moderate to severe cases. And the CPAP works by simply splinting the airway and keeping them open at night. So what we talked about earlier, those soft muscles in the back of the throat relaxing and the airways become more narrow, the CPAP work like a pneumatic splint. So it's a constant pressure. And when you put it on, it blows that positive pressure that can be modified or programmed depending on the finding on the sleep study. But the purpose is to keep those airways open all night so the breathing goes uninterrupted, then the sleep goes uninterrupted, then the stress on the cardiovascular system go down, and hence the reduction in the cardiovascular disease down the road.
Okay.
While it might take some time for some patient to get used to the CPAP, they might not feel that improvement right away. So there was a condition called sleep apnea causing their sleep to be fragmented. Now we strap a CPAP on their face, and now the CPAP is keeping them up all night long. So for those who don't feel better right away, it does take some time in some cases, but eventually, once they get used to it, the improvement in the quality of sleep becomes their main drive to use it over and over again. From our perspective, the risk of cardiovascular disease also is another gain that we look for.
Right. And CPAP is
So CPAP stands for constant positive airway pressure,
Okay.
CPAP. Now, some patients call it CPAC, but we'll get to that later. But it is the most effective way. More than 95% of the time, the CPAP is enough to control that. Sometimes we use a different machine called BiPAP, which is like a CPAP, but it has two different settings. Slightly higher pressure when the patient is breathing in, and a lower pressure that allows them to exhale a little bit easier. So some patients have a problem with that. And there are some other complex medical condition where the BiPAP is more effective than the CPAP to treat.
Okay. So both of those, you're basically going to be wearing a mask. It's going to be pushing some air into your airway to open it up when you're asleep at night.
And that's the principle. Now, the main issue with the CPAP is really trying to get comfortable with the mask. So
Okay.
getting different type of masks tried, attempted, mask fitting, different sizes. This is the most important factor in their adherence to the CPAP. It's rarely the pressure. It's more the inconvenience and trying to find a mask that is comfortable fit, because remember, the patient is trying to sleep with that thing on their face. So if it's the slightest discomfort from it, it's going to be more than enough reasons for
Sure.
them to quit or give up on it.
Yeah. So I hear you saying you need to follow up with your doctor. If it's not your first try isn't working, you
Exactly.
need to keep at it.
The literature said there's around 50% of the people on the CPAP are consistent with it over the years.
Okay.
Our data, personal data, is a little bit higher than that, because depending on how much you get the patient engaged in
Okay.
that decision, how much they understand about this condition, how much they know about the consequences of untreated sleep apnea, then they will be more likely to work with us a little bit longer until they get to that. Those who suffer some major health issues like a stroke or a heart attack, they are more likely to follow
Right.
closely on that as well.
Right. And it sounds like you're having a lot of discussions with people about the importance of it. So again, they're able to buy into it more. If you had another, I mean, I know there's some other things that have been tried for
Yeah.
sleep apnea.
So
What
the other
are your
option,
other
the
options
one
like?
that also common, you can get it over the
Okay.
counter, maybe not as good as the one you can get from a dentist, but these are the oral appliances.
Okay.
The medical term is mandibular advancing device. So
yeah.
the mandible is a joint and it moves. So the tongue is attached to it. if you can move the mandible forward by just few millimeters,
Okay.
sometimes it's enough to move the tongue forward with it and open up the space behind the base of the tongue.
Okay.
So it is more reserved for mild, low, moderate cases of sleep apnea. We don't recommend them for severe cases because they don't work as much as the CPAP.
Okay.
The other option is becoming more and more popular now with the Inspire device.
Oh yeah, I've heard about that.
So the
Hypoglossal.
Inspire, the medical term for it is the hypoglossal nerve stimulator. So the nerve to the tongue can be approached with an electrical current. It works like a tense unit or a pacemaker for the
Okay.
tongue.
Okay.
And that relaxation in the tongue muscle when we go to sleep will cause the tongue to move a little bit backward
Okay.
in the back of the throat, and that can close that space even more. So if you can stimulate that muscle to contract, it will pull it forward, it will open up the space. And the Inspire is not just a simple pacer. It can be programmed. There's a range of output that we can work on it, different type of wavelengths that we can use that will help us to achieve that control. And um, it can reduce the frequency of the sleep apnea significantly. 70 to 80% in some studies show significant reduction in sleep apnea.
Okay.
And it is, yeah, it's more convenient than a CPAP. It's never my first choice because it's a surgery. It's much more expensive.
Okay.
And CPAP remains higher in the chances of having a much better cure than any other option out there,
Okay.
including the Inspire device. The
Where does it go?
So it's like a tense unit. It's a small battery that they can put under the skin, usually over the chest, and they run that small wire all the way to the area under the chin here, where
Okay.
the nerve of the tongue gets
Okay.
close to it. So they can stimulate that. It has another sensor that senses the breathing effort. So we want to stimulate that muscle only when the patient is trying to breathe, and that's when you need that airway to open up at night.
Okay. What kind of doctor puts that in?
ENT usually are the surgeon that do that, and they need to be specially trained in that. And there are several of them in the Louisville area that do that.
So I hear you saying, well, there's two things I want to talk about. One was obviously our BMI is going up, our weight, and is a big factor. Do you guys? I guess I have two questions about that. One would be, do you guys partner with anybody to try to help with weight loss? And the other question would be, do you ever see cases where if the patient dramatically loses weight that they can come off the CPAP?
That is by far the best treatment if it can be achieved. So
Yeah.
weight loss is not just treating the sleep apnea. The risk for all the other weight associated risk factors, including cardiovascular disease, is going to go away as well. So in the past, we used to refer patients to nutritionists, talk to their primary care doctor about option, changing their lifestyle, trying to make them more interested in physical activities. But since December of 24,
Okay.
some of the GLP-1 medication became FDA approved for weight loss in sleep apnea. That's
Heard of
Zepbound.
that.
The other name is Mounjaro. So the same way with Wegovy and Ozempic.
Okay.
Zepbound and Mounjaro are exactly the same medicine, but the Zepbound is formulated and FDA approved and dosed for sleep apnea specifically. So over the last year, we saw a big shift in the way we treat sleep apnea. Now we are prescribing those medication because of the benefit we see associated with the weight loss. If
Okay.
the person gains 10% weight, the risk of sleep apnea goes up by sixfold. So reverse is also true.
Yeah.
If the patient can lose weight, there is a significant substantial drop in the frequency of the apnea event, which make the sleep apnea less severe. And if they lose enough weight, more than 20%, it's like when people used to do gastric bypass or gastric sleeve, that weight loss have more than 50% chance of curing their sleep apnea, 70 to 80% chance of reducing the severity to the low level that it's no longer a significant impact on their health.
Yeah. Yeah. Because, yeah, as you said, the weight loss is going to help all these other things, going to help their high blood pressure.
Exactly,
Their,
not just their sleep apnea.
yeah. Yeah. I noticed on your website you guys said that you treat patients as young as 13. Can you tell us about that?
Yeah, so sleep apnea is not just a disease of the old and the obese.
Okay.
You can be old and thin and still have
Yeah.
sleep apnea. It's more common when you gain weight, but also it affects kids as young as newborns.
Oh, wow.
And 1% of infants have sleep apnea, up to 5% of kids have sleep apnea.
Okay.
And we're seeing more and more increase, especially in the teenager, because of the increase in the obesity incidence
Hmm.
in this subgroup of patients. And the same way it affects an adult, it can affect the child. But what is more critical about kids is their brain is in the development stage. So the impact of sleep fragmentation on their brain is much more serious than the one we see in adults.
Hmm.
They're not just sleepy. Actually, kids can have exactly the opposite.
Oh, wow.
Attention deficit and attention deficit disorder sometimes can be just a manifestation of undiagnosed sleep apnea and not an ADHD condition.
It's incredible.
Exactly. And a lot of time we get kids now, there's more awareness. Even teachers can suggest that to the parents and get your kids checked. Or
Yeah.
the pediatrician are more and more aware of sleep apnea, that it's not just an adult condition, it can affect kids as much.
Are mental health professionals for kids more aware too?
Yes, we noticed
Okay.
that as well. We're getting more referral from them. Before they
Okay.
start the kids on ADHD medication, they always like to rule out sleep apnea because instead of trying to treat the symptom,
Yeah.
if you can cure the underlying condition, it becomes more effective. And the cause of it also changes with age.
Hmm.
In the younger one, between the age of 4 and 8, usually it's big tonsils, big
Yeah.
adenoids
I
is
was
the
going to
common
say.
cause. And in those cases, especially if the adenoids or the tonsils are big, just taking them out surgically is enough to
Right.
cure a big percentage of them. Once you go above the age of 8, especially in the teenager years, we treat it more like adults. Surgery
Hmm.
in this subgroup is not as likely to be as effective,
Hmm.
and we can put them on CPAP. And believe it or not, some of those kids do better than my grown-up adults as
Hmm.
far as committing to the treatment and using the CPAP over time.
So I was wondering, like, if you get on CPAP and you feel a little bit better, do you sometimes see people want to increase their exercise routine or they have more energy or?
A lot of factors are involved. So, sleep apnea causes sleep deprivation, sleep fragmentation. That can increase their appetite
Hmm.
for food, specifically for high carbohydrate content.
Ah,
They did that on animals, they did that on people, the same results. You deprive the person from sleep, they will crave more carbohydrates. Even the hunger
interesting.
controlling hormones are affected in this
Yeah.
subgroup. So it becomes like a vicious cycle. They don't exercise, they're tired and they're fatigued and they have higher appetite. So they end up gaining more weight, which make their sleep apnea even worse, which make them more tired, and it starts spiraling
Yeah.
with that. The reverse will help to fix that. So some patient, when they go on the CPAP, they get more energy, they are more active, and it's just the reason to the they want to get off the CPAP. They like it, they like how they feel on it, but they hate the fact that they have to use it every day. So it gives
Yeah.
them more incentive because now they know how it feels to sleep better. They know
Hmm.
what it feels like to be waking up alert,
Right.
functional during the daytime. So they want to maintain that. And if they don't want to use the CPAP, they have more incentives to exercise, eat healthy.
Hmm.
And yes, it will resolve. We have a lot of cases where we retest them after 10 to 15% drop in their body weight. And a large percentage of them, either they're cured or
Wow.
they go down to a mild level that's no longer considered a risk factor.
That is so great. Yeah, that's really great to hear. And that's motivating for people to go get checked out and to do the treatment and to do the weight loss and all the above.
And that's where the treatment is helpful because some people say, well, let me work on the weight loss first. I want to
Yeah.
lose weight and we'll look at it again in 6 months. Small percentage can achieve that.
Yeah.
And I've seen people losing 50, 60 pounds, and yes, their sleep apnea will go away. But whenever the patient said, I'll see you back in 6 months, 99% of the time, they're going to come back either with few pounds extra or no changes whatsoever. So this
Yeah.
is when the treatment will, and I'm not saying CPAP is going to make them lose weight. I wish that is the case, but
Yeah.
they are more likely to have a successful effort in the weight loss and better results if they sleep better. And this
Right.
is when the CPAP comes in as a bridge therapy to help them achieve that goal.
Yeah, that makes sense. Better quality of life. You have more motivation. You did mention ADHD, and I wanted to round out the sleep apnea talk with is there a relationship between, I mean, I know there's some sort of relationship between mental health disorders and sleep apnea, but does one cause the other, or how does that work?
They looked into that. There's a lot of overlap and back and
Hmm.
forth. So people with depression, most of the antidepressant or the old versions and some of the new ones, they all affect the appetite. And when you're depressed, you don't feel like moving, you don't want to do much, and you end up gaining weight, so it can cause sleep apnea. But the reverse also is true. up to one third of people with sleep apnea have depression. Up to one third of people with sleep apnea have anxiety.
Okay.
And that will give them this attitude that they almost want to give up on it. They don't want to treat, they don't want to do anything about it,
Mm.
and start also cycling, spiraling down where they have more weight gain, more depression, less energy, more sleep apnea.
Mm-hmm. I see. Okay. All right. So I think that leads us into, we'll just talk about sleep generally. So, can you tell us, because I think this is something that, again, if you're not in the sleep apnea category, uh, just a lot of us struggle with sleep. So, what does good sleep look like? What are the consequences of sleep deprivation? And let's talk about some things that maybe we can do to
We
get
are a
better
sleep
sleep.
deprived nation.
We are.
People wants
Oh
to
my gosh.
wake up and go to work at 5 in the morning. They want to, even those who wants to do healthy life choices. Your life is so busy, so you wake up at 4 in the morning to go to the gym before you go to work, and you go to work, you come back home, you need to socialize, you need to catch up with your Instagram and Facebook and so on, and then you end up going to bed even later at night. So even with the best lifestyle choices, being physically active, eating healthy, if you're sleep deprived, you're still inflicting a lot of damage on the brain.
Yeah.
Um, Newborns, they sleep two-thirds of the time. And as the child grow up, there's less and less need for sleep. But what most people don't realize, a school-age kid,
Mm-hmm.
teenager, they need to sleep 9 to 11 hours to
Okay.
get the amount of sleep that the brain really needs. How many kids do you know, including my kids and yours, that get 9 to 11 hours of sleep?
Right.
Adults, it comes down to 7.5 hours.
Oh,
And this is
really?
the average. You have short sleepers that
Okay.
can function very well with 6 hours, and some people need 9 hours of sleep to be functional.
Yeah.
And the way to tell the difference is when you have somebody who is not setting up alarm to wake up in the morning and you let them sleep as much as they want. This is
Mm-hmm.
their way to assess their sleep requirements.
Mm-hmm.
And how many people do you know get 7 hours of sleep? Maybe a small percentage. Some people wait until they retire to do that,
Right.
but the damage is already done. So getting enough sleep is very essential. Put aside sleep apnea or anything else.
Mm-hmm.
Just sleep deprivation itself is a risk factor for a lot of condition. The the people who work night shift are
Uh-huh.
notoriously sleep deprived,
Oh, absolutely.
and just working night shift increase your risk of cancer. Don't ask me how, but
Oh,
it's
wow.
so detrimental to the health in general.
Yeah. Yeah. Yeah, I know. I mean, well, you and I have been there, like where we didn't get sleep, when we were training, and
And we
yeah,
thought it's going to get better when we start practicing.
well, and it's just one of those things that I think that when you're on a chronic night schedule, that you think, oh, I'll adjust. I'll just come home and I'll go to bed at 8 in the morning and I'll sleep till 2. But I feel like it never really feels right.
You put off a lot of things for the weekend, and you find that your to-do list is getting longer and longer. So the weekends is the time to catch up on the things you didn't do during the working days, and you continue with that sleep deprivation. And the sleep debt can be paid back within a day or two. Up to 4 to 5 days, you can compensate. But
Oh,
after 5 days, there's small dent in your health that is never going to be recovered. And when you're
wow.
sleep deprived on the long term, that's when you start to suffer from cognitive impairment,
Okay.
dementia. People with insomnia who are sleep deprived as a result of that have a much higher incidence of dementia as well. And the treatment should help to improve that. And sometimes the treatment is something we offer. Sometimes the treatment is just changing their lifestyle.
Right.
Just getting enough time in bed is important.
Right. Yeah. So let's talk about, there was 3 things specifically with good sleep. I wanted to talk about lifestyle, also maybe some of the prescription meds, and also just maybe other things we're ingesting that could be affecting our sleep. So let's start.
Medication, substance that you take during the daytime. So when it comes to lifestyle changes, having a fixed bedtime, fixed wake up time is the most important part.
Okay.
So we don't just sleep. It's not like you're sitting and you're relaxing. The brain goes through a certain pre-programmed sleep stages, more deep sleep during the first half of the night, more REM sleep during the second half of the night. And they don't just happen when you go to sleep. They're programmed to happen around specific time during that 24-hour cycle.
Okay.
So when you shift your sleep phase, if you, instead of going to bed at 9 and waking up at 6, let's say this is a normal sleep schedule for a person. If
Okay.
they go to bed at midnight and they wake up at 10 in the morning, that's not the same. They
Okay.
will not go through the same proper sleep progression, sleep stages progression. So that sleep is not as good as the sleep that happened during specific time. So you can imagine people who work night shift and flip-flop their schedule,
Mhm.
how poor the sleep quality is, even though they might think they're getting enough time in bed, but that's not enough for them.
Okay. So what you're saying is just again, a very regular schedule is good because you
The
have stages of sleep. So you said the first part is very deep and
deep
then
sleep.
REM.
So the deep sleep is the one that makes you feel more rested the next day, more alert,
Hmm.
more functional. The REM sleep has to do a lot with memory formation at night. So both are important.
Mm.
And when you're sleep deprived, any of those can affect your cognition, your decision making, your
Hmm.
alertness level if you're driving, and that getting enough sleep is not just a solution. You have to have it in a specific time where it's regular.
Hmm. And do you recommend sleep aids?
There's a lot of things over the counter, a lot of prescription medicine for
Hmm.
sleep. The medicine or any supplement is usually or should be the next thing to do when doing the right thing did not work. So
Okay.
yes, there are some conditions where despite their best effort, they're cutting down on the caffeine, they're
Hmm.
avoiding, we'll get to the caffeine and the alcohol,
Okay.
but they do everything the way they're supposed to do, but they're still not able to get enough sleep, either
Mm.
because of some medical condition, medication side effect, or they have insomnia, depression, you name it. Arguments before bedtime can affect the sleep quality.
Right.
Watching your TV or your cell phone
Yeah.
can also affect the ease of going to sleep. So even if you fix or correct for all of these and you're still not having the sleep that you like, this is when medication becomes the next thing to do. But it should never be the first approach for that.
Okay. Two questions
Mm.
there. How much time do you think you should be not on your phone or in front of the TV before sleep? And also, if you do recommend sleep medicines or like say herbals, like what are some of the things you think are safe?
For
Or
sleep medicine, there are prescription medicine.
yeah.
My concern with those one, most of them are habit forming. So
Hmm.
yes, they are appropriate if you're using it in the right context where you're giving it for a certain period of time to fix a problem, but
Yeah.
the intention should always be to avoid long-term prescription
Hmm.
because it's just a matter of time before your body get tolerant to the medication, you get used to it, and then we just created another monster called dependency on sleep medication,
Hmm.
and this is something that they might suffer with for the rest of their lives.
Right.
As far as the thing that we do during the daytime that affect the sleep, like caffeine and
Hmm.
alcohol, coffee is metabolized in our body and the body clears it out of your system over time. So we have people who can break down the coffee a lot faster. They
Uh-huh.
are fast metabolizer and people who will have more time trying to clear that from their system.
Okay.
So a normal half-life, which is the amount of time it takes for half of the caffeine to get out of your system, is 3 to 4 hours. Some people might take 7 hours.
Okay.
So to get more than 90% of the caffeine out of your system, it takes 4 half-life. So you're talking 16 hours on the average.
Wow.
So that cup of coffee in the morning, if this is the only
Uh-huh.
drink you have, yes, more than 90% of it is out of your system by bedtime.
Hmm.
For people who get a cup of coffee or espresso or Starbucks in the afternoon, there is still substantial amount of that in their system later in the evening. And
Okay.
that can affect their quality falling asleep. If they're sleep deprived, they can still fall asleep, but we all wake up several times at night. Even in normal
Hmm.
people, 5, 6 times of waking up at night is not uncommon.
Hmm.
But that caffeine that was not enough to keep you awake when you're trying to go to bed after 16 or 18 hours of being awake, when you sleep for 3 or 4 hours, you wake up, that caffeine in your system, it's enough to keep you from being able to go back to sleep.
So it can be responsible for
Correct.
waking up and not being able
Not being
to.
able to go to sleep again.
Okay. Wow.
And alcohol
Yeah.
is double edged. So a
Okay.
lot of people use alcohol as their self-prescribed remedy to go to sleep. And while it's partially correct, yes,
Okay.
when you drink alcohol before bedtime, you're more likely to fall asleep a little bit faster.
Hmm.
But fast forward 3 to 4 hours and the alcohol level go down, exactly the opposite is going to happen.
Okay.
You will be having much more shallow sleep. And
Hmm.
if you wake up at night, like we do with the caffeine, that's going to keep you from going back to sleep again.
And
So
are these hormonal issues that are happening with these drinks?
not it's they affect the sleep regulator in the brain, the
Mm.
GABA receptor, the adenosine receptor. So these control sleep. Sleep is not just a switch on, switch off. It's the balance of several neurotransmitters in the brain that have to work in a harmony way. They have to work through a circadian rhythm where they fluctuate during the daytime. And when all these are synchronized, that's when your sleep is rapid and deep and you feel better the next day.
Okay.
You switch your sleep cycle. That's the other thing with people who work night shift and they
Right.
flip flop. All those circadian rhythm, your growth hormone level, your thyroid level, your estrogen, your cortisol level, your body temperature, they're all flowing through a certain pattern
Mm-hmm.
during the 24-hour cycle with that circadian rhythm. So when you shift your sleep schedule, they don't just shift along with it.
Right.
And this asynchrony in those systems is what makes the sleep quality so bad.
Wow. So you just reminded me of a couple of things when you were talking about estrogen. We had a talk a few weeks ago about perimenopause and some of the things that I wanted to ask you about sleep. One, I've heard in the past that like progesterone can help with sleep. I've heard things like magnesium, melatonin. What are your thoughts on all of those things?
Magnesium can help with sleep. There's some data to support that. Melatonin, we were all advising for it initially when it came up. The only FDA approved use of melatonin is for jet lag or for
I did not know that.
yeah, but when it comes to prescribing it as hypnotic, as a medication to induce sleep, it's not that strongly supported. And there is a lot of product on the market that use a much higher concentration.
Okay.
To get the normal level of melatonin similar to the one you have at night, taking 1 milligram is more than enough.
Really?
Product on the market have 5, 10,
Yeah.
20 milligram of melatonin. So this is much, much higher and it becomes non-physiological. And the reason why we're pulling back from it now, there has been studies that show that people who take high dose of melatonin have higher risk for dementia. Even congestive heart failure has been linked in patients who take 15 to 20 milligrams of melatonin. So we're phasing out of prescribing it or for recommending it as an outpatient treatment.
Yeah.
Taking a low dose and not on a regular basis, I don't think that's going to be very harmful. But consistent, regular, high dose melatonin is now
Wow.
not recommended.
How interesting. What about exercise? Do you think that that helps people sleep, and is there good timing on that?
It does, as long as you don't do it right before bedtime. So
Okay.
you don't want to have any significant physical activity that increase your heart rate right before bedtime because that can delay your sleep onset. But exercise during the daytime in general is actually very beneficial to induce better and deeper sleep.
Yeah, yeah. Oh, what about, and we'll talk a little bit more about cannabis later, but what about, because I feel like this is a new thing too. Oh, it helps me sleep, like your gummy or whatever it is. What do you think about those things?
It does help induce sleep. We don't have as much studies on the safety on that on the long term. So yes, it might make people sleep a lot faster. The other thing that worries me about gummies, most of them make people gain weight, and that can make their sleep apnea becomes more of a factor.
Okay.
So until we have a more studied, we have that topic more studied and assessed, we don't recommend that yet.
Yeah. Well, and I guess also there's not a lot of regulation of a lot of those products either. We don't
And
exactly know what's in them.
exactly, and they don't have some measures to quantify the amount of medicine. Cannabis is the medicine, and the amount of medicine should be very regulated. That from taking one gummy or one tablet, you should be getting that many milligram of this medication. This is poorly regulated in those over the counter and the stuff you can get online. So that's another reason why we don't recommend it.
Definitely. And do you have any just prescription medications, like not to help you sleep, but ones that you think that could be particularly problematic with people getting to sleep?
Several.
And also for the listeners, just so they know, we're not saying don't take these. We're just giving you some things that you might want to talk to your doctor about.
Just because it can happen in some patients doesn't mean that everybody who takes those medications will
Absolutely.
have that side effect. So
Right.
the common one, for example, are antidepressant. That's why we recommend to take them in the morning, especially the SSRI, because increasing those stimulant hormone in the body can be affecting the sleep onset if you take it at night.
Okay.
That being said, some patients actually have the opposite effect. They
Right.
take it and they get sleepy. So we can always switch that. Whatever we say does not apply for everybody.
Okay.
Blood pressure medication, especially
Okay.
beta blockers, as important as they are to
Okay.
help people with heart disease,
Right.
can increase the frequency of nightmare. They can cause the sleep to be fragmented. They can
Did not
cause
know
the
that.
patient to have insomnia.
Okay.
So it can have a wide range of effect on that.
Okay.
Prescription medication like steroids, they can have significant impact on the sleep quality, especially if taken at night. And these are medicine where, depending on the patient feedback, we can change the timing of the medication so we can still give them the benefit of the treatment without that side effect.
Right.
And the one that is being used more and more now, even in adults, is ADHD
I
medication.
was just thinking that. You read my mind.
20 years ago,
Yeah.
only kids with ADHD will be on Ritalin
Right.
or Adderall. Now there's a significant percentage of adults that take those medication, and they come in different formula. There are the sustained release formula that is slowly absorbed in the body, so it tends to take longer before it's cleaned out of the system. And people can take it in the morning or later in the morning. And by the time they're trying to go to sleep, they still have a neurostimulant in their system that can affect them from being able to go to sleep. So they end up staying up later. They wake up to go to work, so they are restricted in how much sleep they can get.
Right.
They feel more tired, then they want more medication. They go up on the dose, and it start causing it's creating a problem that it's trying to resolve.
Yeah. Yeah. Do you have any solutions for this? I just feel like this whole ADHD thing has been it's like really taken off in the last, like, I mean, since when we were kids, we knew like what, one person like that was on these medications, but now there's so many people.
There's so much more, and when you increase this level of neurostimulant all the time, you deplete your own level of hormones.
I did
So
not know that.
there is a lot of new studies about trying to restrict taking them or take a break to replenish your store of the
Sure.
neurotransmitter. We're still having a lot to learn about that one.
Okay. All right.
But
Interesting.
back to that point, when you're on a medication, it's always good to have a feedback to the person who prescribed it in the first place.
Right.
Don't go to another doctor and say, "Hey, I can't sleep," because it can be related to that medication, and sometimes there's bad communication between the patient and their physician or physician. So you're taking a medicine that help you stay awake, and the other doctor gave you a medicine to help you go to
Yes.
sleep, and you're taking two opposing medication at the same time.
Oh yes, it happens so commonly. And I think like for patients and for physicians in general, and we both know that this isn't always possible, but I think that it's best if you can add like one thing at a time, or and as the patient you can experience one thing at a time, because like to your point,
Correct.
some antidepressants will make people stay awake all night, and then there's some where people are extremely drowsy even during the day. So, I think as a patient, recognizing what you just added, how it affected you, because I don't live in your body. Like I don't know what's going
Correct.
on in your body, and you may be experiencing a side effect from a medication that 1% of the population on studies is experiencing, but you could be experiencing that. So, to your point, I think communicate with your doctor. Also, know
Correct.
your meds list, know what's been changed.
Not the blue green pill and the one and
Right, right.
now we know what the blue pill is, but all the other ones we don't go by the color.
That's right. That's
But
right.
as a general rule, we try to avoid using a new medication to fix the side effect of another medication. You
Yes.
always have to go back and revisit the first medication, maybe
Yes.
change. If they're so scared about losing their ADHD medication, we might not stop it. We might change the formula
Yeah.
where you get something shorter acting or change the timing of it so you can still have the medicine that you really feel it helped you without causing the other side effect that you're worried about.
Right.
And that's where I beg all my patients, please write the list of medication. Don't say it's in the system, because
Right.
there's so many times you go in and they see different doctors, different hospitals. They don't
Yes.
have the same electronic medical record. And when you go over the list of medication, there are so many that are not accounted for.
Oh, absolutely. And you just, I've seen this just with loved ones who've recently been in and out of the hospital 3 or 4 times. And as they get older, it becomes more difficult. But I think, yes, if you start out with this attitude that, as long as you don't have severe dementia, you are responsible for your body and your medications, and you've got to know what's being prescribed, and you've got to ask questions like, why was this prescribed? And if you're concerned about side effects, then, ask about what are the possible side effects or research it yourself. I mean,
And that's becoming more, it's a double-edged sword with researching.
right,
It creates a lot of trouble, but if used properly, if the patient reference to a reliable sources, they can be a good helper
Yeah.
for us trying to care for them.
Absolutely.
But not on Reddit. You have to go to a
Right.
website that
Right.
are really reliable sources of information.
Thank you for that
Not your friend
reminder
on
about
Facebook.
Reddit. Absolutely.
Reddit is good. I mean, sometimes it's an eye opener for things, but yeah, it's
Right.
not a medical reference.
Absolutely. All right. Well, we will move on to two more topics. Snoring disorders. I wanted to ask you about this because I feel like most of the time, people who are snoring, there's a diagnosis of sleep apnea, but sometimes there isn't.
Correct.
So,
So more than 60% of adults can be snorer.
Okay.
Okay.
Oh,
So
okay.
just if you snore doesn't mean you have sleep apnea. Now, if you have sleep apnea, you're most likely a snorer, but not every snorer have sleep apnea. You can have
Okay.
a primary snoring disorder. Sometimes it's more of an impact on the partner than the
Yes.
person himself. So the partner is up all night, they can't sleep, and
Right.
sometimes they're on a sleeping medicine just because they need to sleep over the snoring sound next to them all night long.
Right.
Every snorer who have symptoms, then it's worth screening for sleep apnea.
Mhm.
But sometimes the snoring can be so mild, the patient is healthy, they don't have any cardiovascular disease, they
Right.
wake up refreshed, they're not tired during the daytime. So just because the person snores is not enough to be tested for sleep apnea or to
Mhm.
assume that they have sleep apnea.
What are some of the reasons a person might just snore?
It's a spectrum when it comes to the airway. So that airway that is stretched wide open during the daytime is enough to let the air flow in a laminar, smooth way that shouldn't cause any noise.
Mhm.
As the airway relaxes and the diameter becomes more and more narrow, to be able to take that breath in, that airflow is going to be turbulent flow. That turbulence is what vibrates the tissue, and that creates the noise that we call the snore. And this is the first part of it. And then if you get even more narrow, you can have a partial breathing. So even though the person is not quitting breathing completely, it's called hypopnea. And this can be enough to cause the oxygen to drop and have an impact on the cardiovascular system. So it's part of the sleep apnea disorder. And then the other extreme, when you when your airway collapses completely, this is an apnea, and that's the other extreme.
Can you treat just snoring?
Yes. So when it comes to snoring, it becomes a little bit difficult because snoring is more of a cosmetic disorder at this point, and it's not a medical condition. So trying
Sure.
to treat it is going to be not. It's something that's not covered by the insurance.
Yeah.
There are a lot of things that are sold online, advertised online that can help
Okay.
with the snoring. They don't all work, and those who work don't work on everybody the same way.
Okay.
You can have the nasal strip, you can have the oral appliance, and this is like the prescription oral appliance. And sometimes you need just 1 or 2 millimeter of advancing the
Okay.
jaw just to fix it. So you can try it, make sure that it's properly fit, and make sure that it doesn't cause the jaw pain that can happen afterwards. And sometimes patients forget that I'm having headache, I'm having jaw pain, and they don't link it to the onset of starting using this oral appliance. So this is something that they need to discuss with their provider when they come with a headache, trying to make the connection between using something for the sleep apnea and the headache onset.
Do you generally feel that these mandibular devices should be gotten from a dentist, like fitted, or are you okay with some of the online ones?
It's better, but they're very expensive,
Oh,
and not
okay.
all insurance cover them. So for somebody
Yeah.
with snoring condition, it can run to $3,000-$4,000 to
Oh,
get
wow.
that fitted and prescribed through a dentist. So buying them for $50, $100, $150, this is the price range online.
Yeah.
Sometimes it's not that severe,
Yeah.
and it might fix the problem. Some people don't use it every night. They snore only when they drink alcohol before bedtime, and they might have that on Friday or Saturday night.
Right.
So having something that they can use to help them on that night and keep the wife happy the next morning, it's worth it. Worth $150.
Right. Or you skip the alcohol, save some money.
Another thing,
All right.
when it comes to snoring,
Yeah.
personal experience, we have, you see that questionnaire that patient fill when they go to the sleep
Yeah.
clinic. There's a lot of boxes they check. Do you snore? Do you wake up tired? Do you have night sweats? Women, 99% of the time, they never check that box. And when you ask them, no,
Mhm.
I don't snore, but my husband says I do.
That is so funny. Yes,
Always the case.
I have been told before that, intermittently I will have periods where I don't snore and where I do snore. And I always wonder, is it
And it can be
if
certain
you,
position you're in at night.
yeah,
It's more likely to snore when you're on your back, and you can buy those sleep position devices that just
right,
can keep you from sleeping on your back. And sometimes that's all what you have to do.
right.
Some people have sleep apnea severe only on their back and barely none on the
Interesting.
side, so they can potentially benefit from that. Again, they're not as guaranteed to work as effective as the CPAP, but
Yeah.
for some patient, it's a valid option.
That is so interesting. Yes, I've definitely known people where if you just turn them over on their side, like, so
Turn
it's
over.
so funny. All right. Well, I think one thing you and I talked about that it's not as much, it still is a little bit on the
Mm.
sleep topic, but one thing we wanted to sort of round out with was because I was just curious from your
Mm.
pulmonary expertise standpoint, as when we were growing up, all the baddie stuff was like, we were discovering how bad tobacco was for us. And now, it seems like there's just a lot of vaping that goes on and also pot smoking. And I was just wondering from, pulmonary and sleep standpoint, what are you seeing in those areas?
There's a lot to talk about from the pulmonary. From the
Okay.
sleep standpoint, nicotine is a neurostimulant.
Yeah.
So smoking before bedtime is enough reason to keep the person awake and cause problem with the sleep
Yeah.
onset. Now, from the pulmonary, that's the majority of the impact we see. And the best way to quit smoking is never smoke in the first place. Once
Right.
you're hooked on it, that's when the
Right.
chances of lung disease happen. So if we can keep those young kids from smoking in high
Sure.
school, it's much better for them down the road.
Right.
There has been a lot of improvement. So if you go back 20, 30 years ago, 23 to 29% of high school kids used to smoke.
Oh, I believe it.
That number had dropped down significantly.
Yeah.
So it's now down to 3%
Yeah.
of kids smoke. It's now it's like a stigma. If you smell like cigarette, it's not as
Right.
appealing as it used to be. But on the other hand, the vaping kind of
Right.
picked up and
Right.
it replaced smoking, which is not a safe alternative. It
Mm-hmm.
has a different problem by
Mm-hmm.
itself, but it's not safe.
Mm-hmm.
We learned few things, bad things about the vaping impact, and there are a lot more to learn down the road.
Yeah.
How many years it took us to figure out that smoking can cause lung cancer?
Right.
We used to smoke in hospitals. Patient used
Oh,
to have package of
absolutely.
cigarettes
Yeah.
in the hospital room. So vaping is just started a few years ago. It might be causing even more serious side effects. So this
Yeah.
is something we learn over time. But specifically in high school, that went up from barely none
Mm-hmm.
10 years ago, now up to, depending on the study, 18 to 23% of kids in high
Wow.
schools vape some sort
Right.
of vaping product.
Right.
And if you smoke, whether vape or cigarette, people who vape are not safe because the chances of smoking combustible cigarettes down the road is much higher in kids who start vaping early on.
Mm-hmm.
The impact on their development is another thing. There has been some studies that showed that the prefrontal cortex, which
Mm-hmm.
is an important part of the brain development, it's not something that matured by the age of 18. It continued to grow until mid 20s.
Okay.
And smoking affect that. And this is the part responsible for emotion regulation,
Mm-hmm.
for decision making, and the another area of the brain, the hippocampus, have been shown to be also reduced in people who use a cannabis product down the road. So
Mm-hmm.
there are a lot of irreversible long-term manifestation of that down the road that once they happen, it's already too late.
Right.
And people who use cannabis, whether it's vape or any other form of cannabis, they have a much higher risk for substance dependency down the road,
Mm-hmm.
use other drugs, and depending on how frequently they use it will also dictate the chances of being addicted to it down the road.
Right.
The product that have THC of cannabis in it also picked up over the years. And
I've heard this.
the even people who smoke it, the
Mm-hmm.
amount of THC, which is the chemical compound that uh, gives you the effect, the medical effect from the cannabis, had been increased in the flower of the cannabis over the last 15 years. It went from being 4% up to 16% of
Wow.
medical cannabis in that cannabis flower. So by crossbreeding and the
Mhm.
way they grow them now, there's 4 times more cannabis in it compared to 20 years ago. And when you take it in a vape form, they can have it concentrated from what used to be 4 to 6%
Mhm.
10, 15 years ago. Now some of them have 60 to 90% the concentration of
Wow.
THC in those vaping product.
That is so interesting.
And another thing, when the person vape, not you, when the
Not me.
person uses the cannabis from the vape,
Mhm.
especially the one that have some vitamin E acetate in it,
Okay.
this is when we saw the surge in the e-cigarette associated acute lung injury.
Uh,
And these are kids that get admitted and ended up in the ICU on the
oh,
ventilator,
wow.
some of them with irreversible damages down the road. So it is not safe.
Yes. And what was that from? Was it from the substance itself, or was it from like the cartridge that's coming through,
It's
and what
because of
was
the
the lung effect?
misconception about it's not just vapor and
Mm-hmm.
nicotine.
Mm-hmm.
Those vaping products have organic substances, they have heavy metals in them, they
Mm.
have nicotine, they have carcinogens. So
Mm-hmm.
it's not just vape and water. It does
Mm-hmm.
have a lot of chemical that can affect the lung down the road and the
Okay.
brain.
And what kind of lung were you like when they get admitted to uh, the hospital? Like, what kind of lung stuff were you seeing?
So the milder part, the one that does not make them sick all of a sudden, is the increase in the risk of COPD and asthma. So people who vape, uh, especially if they have
Okay.
a THC product, they have a higher incidence of asthma.
Okay.
I think 27 to 30%,
Mm-hmm.
and COPD down the road. But if you use the product that have the THC in it, specifically the
Yeah.
cannabis, these are the one that can have acute lung reaction, like a severe inflammation
Wow.
that called ARDS. That's what you see in
Yeah.
people with COVID when they come in
Right.
and the lung is so severely inflamed that all the oxygen we can give is not enough, and they have to go on the ventilator just
Yeah.
to help them go through that acute phase. And some of them don't make it.
Yeah. It's so interesting how, again, just public opinion has changed over time about, we've really made it so much more accessible to have access to things like, cannabis. And I'm sure there's plenty of people out there who love that. But at the same time, it sounds like it's the, the amount that is being ingested has changed over time. It's a lot more. And like you said, the plants are being bred a certain way. And
The way I like to look at it is it's a medicine.
yeah,
And like every medicine, you don't just pick up a prescription medicine and you take it because you think it's going to help you.
yeah,
There has to be the right setting for it. There has to be a physician that can follow up on that, monitor, and then it can be there's a range of dose that you can use. So this is when having a proper trained physician
hmm,
on board to help with that if it ever get to the point to use medicinal cannabis for that.
right,
But having
right.
it available for whoever wants to use it, there's a lot of debate about that, and there's still for us a lot of things for us to learn and know about down the road.
Absolutely. Yes. Yes. Definitely evolving topic. And as we both just talked about, we learned over the years just how dangerous tobacco was. We didn't think much about it. We used to all the movies, everybody
Cool.
smoked, and like you said, people were allowed to smoke in public places, and yeah, just we'll see. Time will tell. Okay, Dr. Saad, we're going to wrap up with just a couple of hopefully maybe just some fun questions that you might have already answered some of these, but we don't always do this on the show, but sometimes we have a little bit of a rapid fire at the end. So I don't even know if you remember, I think I gave you some of these, but I'll start with this one. And again, maybe you've already answered it. What do you think is the biggest myth out there that your patients believe, or what are you seeing the most of?
When it comes to sleep, the fact that CPAP is or can be harmful if they
Okay.
have a power outage at night, they feel like they're gonna be waking up suffocated. Those
Oh,
things are engineered not to let that happen.
okay.
So if there's a power outage, you can still breathe with the CPAP mask on. You will
Oh,
not suffocate at night. And when it comes to the vaping product, we just talked about that. They're not safe alternative. These things can be harmful, and they need to be
right,
considered as harmful until proven otherwise.
right, right. Okay. How about anything else about like that you think social media is getting wrong in your field of study other than the vaping?
There's a lot of advertisement on social media, and there's no regulation on what they can say. So,
Yeah.
what really kind of draw my attention, some of them say CPAP don't work or CPAP is not. This is absolutely wrong. And
Oh,
having some of those over the counter nasal strip or
yeah.
some of those electric stimulator you can
Yeah.
kind of put on your chin, they're not effective. They're not
Right.
really studied to achieve the same result you get from the CPAP or from medically planted inspired
Yeah.
device. So people needs to always take it with a grain of salt that
Right.
as long as there's no regulation, those ads can say whatever they want,
It's
and
true.
people needs to be very careful who to believe.
Yeah. Yeah, absolutely. I mean, that's got to be a little disheartening for, for you guys in
And
your
it,
line
it
of work.
really makes
Yeah.
our job a lot more difficult
Yeah,
because
absolutely.
they give the image that the CPAP is the worst thing that can ever
Yeah.
happen to a patient, and they say the picture of somebody who's struggling at night and
Right.
tossing and turning is like a torture device. It
Oh
is
my
not. It does work.
gosh. Oh my gosh. This is so interesting because I'm not getting any ads like that. So it
It will
must
show
be,
up. It will show up on your phone
it
because we just
will.
talked about it. It's
It
listening.
will. You and I are in different algorithms, it sounds like. All right, let's see. What else? If you could recommend one sleep habit for better sleep, what would you choose?
Having regular bedtime, wake up time, and
That's the
enough
first thing you
time in bed.
said. Yeah, yeah. And that can be really
Mm,
tough for people. So we
yeah.
recognize that. But we're going to give you you can do it. We're going to give you a pep talk. All right, let me see. Okay, last one. Is there something you've changed your mind about in the last 5 years, medical or otherwise?
Hmm. Good question. Well, lately we've been more active in helping patients with the weight loss because now we have the tools to
Yeah,
help them with them that we did not have that a few years ago.
yeah.
GLP-1 kind of made a radical change in how we approach not
Mm-hmm,
just diabetes,
mm-hmm.
also problem with obesity. And like every other medication, not every person needs to be on that. Not
Right.
everybody with just few pounds extra weight needs to be on medication. But for those who struggle with the weight loss,
Mm-hmm,
those who are not as blessed as some of us with good metabolism, you can
mm-hmm.
have patients that really do the right thing. They try to eat healthy, they
Yeah.
try to exercise, but maybe they have bad metabolism, they have hip injury, knee injury, they just cannot. This is when having a medication to help them with that
Mm-hmm,
becomes pretty good, and we've seen good results with it.
mm-hmm,
Some side effect as well, and some life-threatening side effects. So
mm-hmm,
every medication
mm-hmm.
needs to be weighed properly, where you feel like the benefit you're getting, the potential benefit outweigh the risk. Then yes, it would be an option.
Right. And discussing those side effects and the pros and the cons with a trusted physician is
Correct.
always, yeah, the best thing. Yeah. Well, thank you so much, Dr. Saad, for being with us today. I really appreciate you for coming in, educating us. You just even educated me on a few things I didn't know about, and it's such an important topic. And you took time out of your busy schedule. I really appreciate it.
Thank you for giving me the time just to explain
Yeah.
things that are so common that many people suffer from, and give them at least a chance to pursue looking into that and see if that can help them be healthier.
Right, exactly. Yeah, yeah. And listener, thank you for being here with us today. We couldn't do this without you either. And I am going to guess that if you've stuck around to the end, that this is an important topic to you. So share the gift of good sleep with a friend. Tell your friend about our show. I am on YouTube, Spotify, TikTok, and Instagram. On YouTube, you know the drill. Please subscribe to the channel. It is free and like the video. And I don't know what you have going on tonight or this week, but I can say from the bottom of my heart, and probably Dr. Saad as well, we hope that today's episode helps you get a great night's sleep. You deserve it. Take care of yourself, and I will see you soon. Bye.